The only thing I would add about liposuction after pregnancy is that a lot of times the skin just doesn't have the elasticity to draw back without creating some kind of contour abnormalities or waviness or things like that. And so even when folks don't have stretch marks, sometimes after pregnancy, they still are not a great candidate for liposuction. And sometimes they are actually candidates for just having liposuction on one body part or multiple body parts. Everybody would like to have smaller incisions and have little to no scarring. And when you do a tummy tuck, you do have a longer scar. And so most people would rather hear liposuction is the option for them, but the reality is it's oftentimes not. But it is commonly added on to other procedures just to kind of smooth a little of this or a little of that in areas where the skin may be more resilient, or in the case of a mommy makeover, maybe was never really stretched or particularly stressed out. There are other non-surgical options. In our office, we utilize cool sculpting, which does, seem to help pretty consistently. You may have to do multiple rounds, but it's a great option that's non-surgical with very little, close to no downtime. Most people don't feel like going and exercising right after they're disconnected from the machine, but medically speaking, they could. And so most people are back in action without garments or without recovery very quickly. And the only challenge with non-invasive type procedures like cool sculpting or in smaller areas, something like Kybella, are that it's your body's reaction to that stimulus or that irritant. And if it doesn't respond enough, then somebody might be underwhelmed by their outcome. If somebody comes in and they've been appropriately told this is going to take you 2 or 3 rounds, and so we'll just see how you respond to the first one and then go from there, but knowing that they may need multiple treatments. A lot of times people will be very happy with a non-invasive procedure. And then some people want to know that that fat was removed from their body and was in a canister across the room and they never have to see it again, in which case they may decide for something like liposuction. Sometimes you can do fat grafting with fat that's been removed. There are varying results in different body parts. It can be injected on other body parts of the breasts. I do a lot of fat grafting on the face because I think it you see that benefit very clearly, and it's small volumes, and it's a great little refresher, lasts longer than things like fillers.